to another episode of Teach, Learn, Share, a podcast that thoughtfully explores teaching and learning practices in higher education. I'm Margot Eckenberg.
And I'm Jasmine Farah. This podcast is brought to you by Teaching and Learning Services at McGill University. We're recording today from Montreal, Quebec, on unceded land, which has long served as a site of meeting and exchange among Indigenous peoples, including the Haudenosaunee and Anishinaabe nations. We honor their stewardship as we live and work on these lands. So today we're going to be speaking with an instructor whose strategy teaches students about bias. We know that the topic of bias in general is an important one that crops up in many disciplines. And in our first mini-series, we spoke with Charlene Lewis-Sutherland, a senior advisor in McGill's equity team, about the relationship between implicit bias and assessment and how it can negatively impact the student experience. I highly encourage our listeners to go back and check out that episode. It's episode 2 of our first mini-series on assessment and well-being. So in that episode, Char emphasized how important it is to take a step back from established systemic processes and strategies that are carried out in higher ed, like assessment. Now that we kind of know and better understand more about learning, about how the brain works, and are just exposed to different ways of thinking. So while taking a step back, we ask ourselves, do these methods truly serve everybody? Or perhaps are there certain groups being unfairly advantaged while others may be unintentionally excluded? And this type of exercise can really apply to all fields and systems, not just in education. And I do acknowledge that changing a system is a very big task and it can feel overwhelming. However, it can start with exercising our own awareness of our own biases, which can be very difficult because many of our biases may be there and we're not even aware that we have them. And I can appreciate that teaching students to tap into that part of themselves is sensitive and challenging. What are your thoughts, Margot?
Yeah, regardless of whether we're talking about assessment or not, I feel so strongly that these reflections on our biases is something that we should all be doing. I feel, too, that we have a particular obligation to be working on this in a university environment. And that's not just because the work is being done around us, but because we have an obligation to our society, whose young people we work to educate. So if we're concerned with the business of constructing knowledge, we need to be aware of what kind of knowledge that is and what kind of power dynamics it potentially reproduces or questions. So you're probably wondering what all this has to do with assessment. And I wanted to say that by bringing the question of bias to the forefront of assessment means that that's what the instructor values, even values, in fact, enough that they want to assess whether their students have learned that which the instructor values. So the very fact that bias is a conversation in an assessment strategy is really something we should be paying attention to, and students become aware of how impactful this might be. And I wanted to return just for a moment to the first episode of this series when I mentioned Natasha Jankowski's 4 characteristics of good assessment practices. She speaks about increasing assessment literacy, promoting more transparency, involving students in the assessment practice, and focusing on a sense of belonging or mattering. And I think assessment that urges students to reflect on their own bias or the process of recognizing bias can be decisive in the sense of a student's understanding of belonging and mattering. So why does this matter? They might ask themselves, and what's my role or what's my place in what I'm being asked to do? And on top of that, asking themselves, why am I even being asked to do this assignment, can potentially increase their own literacy as they become more aware of how assessment is part of teaching and learning. It's not outside of learning course content, it's part of the learning. And I think learning about ourselves is part of getting an education. So I think with that, we're ready to bring our guest into the conversation.
Today, we've invited Dr. Alissa Levine to the show. Alissa Levine is a sociologist with a PhD from McGill who has contributed her qualitative methodological expertise to research projects in the Faculty of Dental Medicine and Oral Health Sciences. She focuses on the health of marginalized groups as well as on the curriculum, which includes teaching, research, and program development. Dr. Levine currently directs the Masters of Science non-thesis program in dental sciences at the faculty. Welcome, Alissa. Thank you so much for being here with us today. We're thrilled to have you on Teach, Learn, Share, and we're excited to learn about your assessment strategy.
Thank you. Thank you very much.
So we'll dive right in. Can you describe the assessment task on uncovering bias that you assign to your students in the dentistry course? And please let our listeners know about the context of your course, so the subject, class size, year of study of students, that sort of thing.
Okay. So this is a course that all our second year students who are going to become dentists have to take. And it is open only to them. Right now it's called social justice, and it's evolving, and it's going to become an even more a bigger course. But for the moment, it's just a few sessions over the course of their second year before students actually start to see patients. And we want to get them starting to think about issues of social justice and equity, diversity and inclusion. We want them to think about themselves, first of all, their personal identity, and then how that contributes to their professional identity. And so that's largely what this course is about. And in that context, reflecting on your own biases is very important, as it can impact on how you will ultimately act and treat patients in the end. So in terms of like the assessment strategy, I think maybe one of the things that I want to emphasize about the way we do this is that I would consider the assessment strategy to be somewhat indirect. The main focus is on what has made me who I am today, and how do I self-assess, and then sharing more the process of that self-assessment, as opposed to saying, okay, pinpointing, yes, they have to pinpoint a bias, but really expressing how they've, thought about and learned about this whole process. Because going into this, nobody knows everything about it. Some people have a little bit of an idea, but it's really about reflecting on the whole process.
Yeah, I mean, I think it makes a lot of sense to have students reflect on the process of pinpointing a bias rather than having them jump straight into identifying their biases, because as we kind of talked about before, you might not know how to do that without some guidance, and we might not know what or where our biases are. I also think in the long run, teaching them the process better equips them to learn more about themselves, and it really just gives them a tool that they can use on the course. So I think that that's great. Can you give us an example of a specific activity that you have them do that's part of this strategy?
So, for example, instead of asking students to talk about a specific bias, we give them an exercise and we kind of jump right into it before talking about it too much. And I'm going to just share a couple of pictures that we use. So I have students evaluate these two pictures, and they'll start with patient A, and it's a pen and paper exercise. So the students know, and this, I tell them I'm not taking this from them. So they know that it is not going to be recorded, not going to be assessed by me. So it's a self-assessment where they try to characterize patient A, their likability characteristics, check all that apply. This patient is kind, he's impolite, or he's honest, or he's pretentious, so we have obviously some positive and some negative characteristics. And of course, the expectation is that everyone will choose the positive characteristics. Similarly, then they're asked about this patient's dental cooperativeness. Is this patient a regular attender? Does this patient communicate well? Do they follow through with their treatment? And then also some negative characteristics, like they arrive late, or they make unrealistic demands of the dentist. And once again, we expect students to choose positive characteristics ultimately, and typically then do, but they don't realize is trying to explain how we go about reflecting upon and measuring bias. And then they do the same exercise with a lighter blue-skinned cartoonesque character. And so they understand, because they see there's one that's darker blue and lighter blue, they understand that this might be, akin to some kind of comparing races or something like that, which is going to be a subsequent reading they'll have. But the idea is that I want them to understand what goes into assessing and being assessed. For example, did it take you longer to say that this character versus this one was likable? And that length would be how long it took you to check off the positive characteristics for the darker blue versus the lighter blue. Then they're like, okay, so that's how you could measure implicit bias. Even if I am not aware of it, even if I say this patient is likable and that patient is likable, there's a it takes me a split second more perhaps to say that the dark blue patient is likable. If this is a possibility if you have a certain form of bias. So it gets them to understand sort of how we could go about appreciating and accounting for the forms of bias that are quite subtle. And it's a fun exercise. I think it's a good way to kind of get them to understand the underlying sort of mechanisms that help us be able to sort of point to and define this type of bias, a more implicit or subtle bias.
Tapping into our own reactions and being honest about them, that's hard. And even when someone's not at a stage where they can recognize bias, I would think that just accepting that you might respond differently to two different images that simply have different color tones, that can be hard to accept, to see that in yourself, right? That your reaction is different. I think you've pointed out, Alissa, that it's really a process. So it seems to make a lot of sense to me to have several components of the assessment task or even several no-stakes assessments in this particular course for working on bias this way, because it really allows students to work through this process of first sort of recognizing in yourself perhaps something that you didn't know was there, even if it means a reaction that you weren't expecting of yourself, and then eventually working towards bias. Can you describe the other forms of assessment you use in this course?
Other forms of assessment include reading an article and trying to imagine how you would act. So they read an article about dentists, and the dentists are presented with a supposed black and white patient, and they're given radiographs and basically patient charts, and they have to make a decision about diagnosis and treatment. And so this study is fairly recent and found that, a lot of dentists will give a different treatment plan based on what they assume to be the race, whether black or white, basically, of the patient. So that got them thinking about this, and they had to read that article. And given that they're all future dentists, this was something that they speak to and reflect upon. And once again, sort of gets them to talk about it without self-identifying, although there can be a bit of a resistance when it comes to, do I see myself? They can identify it quite well with the dentist sometimes and saying, maybe this isn't a question of racism. Maybe it's more, they assume this patient has less money and they don't want to propose a treatment plan that the patient can't afford. Maybe that's why they're suggesting, for example, that a black patient have a tooth pulled, whereas a white patient, they're saying, well, we could do a root canal or something like that. So there you can see their thought process, but at least it's forcing them, or not forcing, but pushing them to recognize their own thought processes, which is another part of the journey into recognizing what the components are of bias. We have them do the project implicit, which is a test of implicit bias. These online tests, they also choose which one they want to do.
I actually was very recently introduced to those tests of implicit bias. I am working with an instructor on an entrepreneurship course, and the last module is about inequality in entrepreneurship, and they're amazing. I've never taken an implicit bias test before. There are so many different forms of bias that can come up, but that's something we can definitely include in our show notes to link users to, because it was very, very eye-opening, interesting.
For sure.
I just have a question about I'm assuming those are various strategies and activities that you do throughout the term. Is there a strategy to the sequence in which you present these? Because I can appreciate that this is a very sensitive topic, and there's probably a sensitive, proper way to carry it out. So can we comment on,
For sure. Yeah. So actually, it's logical to start looking at personal identity, and then to expand out into your developing professional identity. So that's how we designed the course. So I think that's a good way to sort of, it's like the grounding, and then beyond, then we move on to how that can affect your professional identity.
I'm really happy to hear that this is part of a course devoted to social justice in the preparing health professionals. They tend to be students that are very focused on the end goal, right? And I wouldn't want this to be seen as something sort of as an add-on or not as important. So I'm a little curious about how your students feel about that. Do they really recognize, I think you alluded to it a little bit, but do they recognize the importance of this? And are they in the self-assessment? Is it still something that you would becomes meaningful for them in the context of the course?
I think so. We actually have a little bit of a smorgasbord of courses where they're doing sort of social justice oriented work, because there's sort of this notion of community dentistry and what you need to be doing and how you can do outreach. And so this isn't the only course that reflects the philosophical underpinnings of the faculty when it comes to sort of serving community and serving the underserved kind of thing. But this is the course where they're going to focus on their own sort of personal, how they connect personally with this. They don't get that chance always, I guess, in other courses. Yeah. And I also personally think, as a feminist sociologist, that the personal is professional and the personal is political, but it's also, professional. So, the first step is to get to know oneself and recognize how your roots and consider how these roots maybe affect us when we go out into the world. So, in fact, the course came about due to this recognized need for students to contemplate who they are and who they should be as a professional. We're pretty sure that a racist or ageist or ableist person can be expected to, bring those biases into the professional world and how they would, in this case, treat patients. So, that's why we kind of want them to really think deeply and have this sort of assessment. And it's almost like a safe place where you don't have to share everything about your self-assessment, but you need to share at least the process of it.
I think this is such an interesting and unique type of assessment strategy, being guided or scaffolded to reflect on who you are as a person on the inside and question why you might be that way. In an academic environment, especially in a medical type field like dental sciences, students are usually focused on learning and applying this enormous amount of content that's external to them. And even in a case when, they're learning about something like patient care, they're learning the proper and professional way to care for somebody that's still external to them. However, in this particular course, they're really having to take that lens and turn it inwards and, pretty much take a magnifying glass on who they are as a person. And I just feel like it's not something students in general are used to doing.
Actually, I think things are evolving. Like this course, the first version of this course was not started by me. A few years ago, it came out of an incident that happened at another dental school in Canada, at Dalhousie. And there was a real scandal where, dentistry students were, there was sort of like this core of male dentistry students who had what they thought was a private group, but they were saying some really horrific things about their colleagues and their female colleagues. And then it all kind of exploded in the media. And a report came out of it. And that was sort of where dental schools started reacting or trying to be proactive on this and say, okay, we need to recognize how these supposed personal issues can clearly carry over and can be very dangerous in the professional realm as well. So that's sort of how this got started many years ago. And the funny thing is now we talk about it and we share these past incidents and all of the students are uniformly horrified. That's why I say I feel like we're making progress as a society, where we recognize that, there's so much that's not, I don't want to say no longer because it never was, but that's now recognized at least as completely unacceptable and that we need to figure out how then to behave properly.
Absolutely. I remember that incident.
Oh, do you? Yeah.
I do. Yeah. That was pretty terrible. It's interesting to know the roots of where this started. It should have been there before, but yeah, I'm happy that it's a part of the curriculum now. What are some of the challenges that you may have come across in these activities, and how did you overcome them?
There's a few challenges. I would say certainly in the past, so this is the third year I'm teaching this, and 3 years ago, there was more resistance to recognizing one's own biases. Like some students just were really, really unable to recognize their own biases and unwilling to express them. But I think that there was a real lack of recognition behind that. That's no longer the case. So in a way, I feel like, society is helping educate everyone because students no longer will say, oh, I don't have biases. It's a little bit of a knee-jerk reaction to focus on others' biases, because I think it is a way of kind of avoiding your own. So I would say that is a challenge, is to get people to move beyond looking at others and being able to point at themselves or focus in on themselves. There's not a lot of finger pointing. It's mostly about what am I learning from the process, and what is this experience teaching me? So it allows them to kind of skirt the issue a little bit in terms of self-identifying in certain ways.
You basically have to make them very comfortable with being uncomfortable.
Yes. Well, that is the hope. Like, I'll give you an example. Students now, 3 years ago, this wasn't as easily the case, but students now will readily say, okay, so who am I least exposed to? I bet I have a bias there. So, for example, we had a racialized student saying, I think that, I have very little exposure to people in wheelchairs or with walkers or anyone who's differently abled than I. And so that student took the implicit association test for able-bodiedness and discovered that, they were indeed biased against those who were less able-bodied. Then we can turn the reflection to what are the implications of this for, and we know, like, I have colleagues who work on accessibility for here in Montreal, and there are most dental clinics are not accessible. Even when they say they are, there's going to be that one step up that a wheelchair could never get up. So they begin to recognize that the way they think about others is going to affect the way they think about their patients, and is probably going to affect the way they set up their dental practice. And so, it's really interesting, and that, of course, carries throughout the course subsequently.
Do you have any tips for other instructors who might be interested in implementing a similar strategy? Or there's some concrete tips you would pass along? And also, is there anything else that you wanted to share that maybe we haven't asked or that got left out?
So, if I had to give advice to anyone who was planning to do this, I guess what I'm lucky to have had, which is that this course is actually pass-fail. So, I think that if there's some way that even if it's not a pass-fail course, you can still have elements of your course that are pass-fail or that are based on participation or based on just students doing an exercise. So, this is the kind of exercise, if you're going to undertake, that I would recommend doing something more like that, where you don't make students feel vulnerable or you make an effort not to. So I would say that, if there's some way not to grade it, or if you are grading it, focus on the process. So they need to show awareness that biases exist, what kinds there are, where they come from, how they affect interactions, what can be done about them. So there's a lot of things that they can talk about without sort of bringing it back too much on themselves directly. In terms of the question that I put to students initially before taking the course on evaluation, I would just say, describe your process of reflection on unconscious bias. Include insights into your personal stance gained from the class discussion, from your reading of the pertinent article, and from the online evaluation, which was this implicit association test where they can choose from any number of tests and choose which one they want to test themselves on. So, they were asking them to reflect on the process. So that was kind of like the very broad instructions we did before learning about how to help students along. And I think I'm doing much better now. So then, now for each assignment, we've broken it down. So for this assignment, we call it personal stance. And we've broken it down into 5 parts. So we ask them to describe societal influences and or family influences on them. They can identify an issue, but they don't have to. That has influenced who they are, who they think they consider themselves to be. And we ask them to describe how they distinguish themselves from all these other influences. So yes, you have a family, you have society. What makes you different? And then we ask them to define bias, conscious, unconscious bias, and this is the one area where we make them perhaps the most vulnerable when we ask them to describe a way in which they were or are biased. And then they have to allude to the assigned reading in the class discussion. And that's another rubric. And then the final rubric is they have to allude to their experience with the online evaluation of bias we don't ask them to divulge what the results were. They can rather write about that experience. So that evaluation grid, breaking it down like that, is actually, that's thanks to TLS. And I think it was a good thing.
Well, thank you. Those were really kind words. And I think you're giving back now because you're helping teaching learning services too, by sharing your strategy that will reach beyond what we do as well. So thank you so much for being on the show, Alissa, and for sharing your insights with us. I'll let Jasmine also pipe in to help us close out the episode.
Thanks.
Thanks so much, Alissa. That was really interesting. I think it is a topic that is important and very transferable to many disciplines. So I hope that others listening in other disciplines may consider taking on some of these types of activities. Thank you for being here today. Greatly appreciated. We ask our listeners to please subscribe to Teach, Learn, Share and let others know about it. Watch out for our next episode. Until next time.